3D mammography is essentially a new field in mammography. So it's really important that radiologists get trained. And it's one of the things that we at Rose Imaging Specialists have focused on in every aspect of breast cancer imaging. And 3D is no different. It's even more so. What we see is radiologists, if you are going to take full advantage of the technology, most people will see more cancers with 3D. But the important part is to find the subtle lesions, as well as to avoid calling patients back. What I see some radiologists who are just getting started with 3D, they call back the same patients they would have called with 2D, and then they call back the things that they would see on 3D. Well, that's going to lead to a lot of unnecessary testing, in my opinion. So I do think we've got some work to do to get everyone up to speed on this. This is not, it's a new technology and it will require more training. I do think in the end, those of us that are dedicated to using this technology will find that it works amazingly well. Studies have shown that it does matter who reads your mammogram. And it's not just the number of years of experience, in my opinion, and not just my opinion, but what we've seen in our research is that it's being focused on that. And our practice, we've always been focused on that since I formed Rose Imaging Specialists in September of 2000. We have been tracking our results. And so over time, we share information, we share interesting new technologies, and by doing so, everyone in our practice continues to increase their performance over time. It's our challenge for the rest of those who are doing breast imaging to do the same thing. I think that's one of my major goals. By forming this group that's now one of the largest in the country, it's our goal to set the standards for how breast imaging is performed in this country. The one thing I would advise women to do for their breast health is the one thing we know works. There's been a lot of publicity around mammography, but the truth is we do know that it saves lives. In this country, we've reduced mortality from breast cancer by 40% by implementing a screening program. It's my conviction that as we do that job even better on our side as breast imaging specialists, that number will get even better. And what we're also seeing is we'll be able to disrupt fewer lives at the same time, saving lives. And that's an important thing. So I think women, the message I would give women is make sure you're going to a specialist who is focused on doing this and ask them about their report card. If they don't know what you mean when you ask them about what is your report card, you're probably not at the right facility.